Equine gastric ulcers can affect any horse at any age. Up to 90% of racehorses and 60% of show horses, as well as non-performance horses and even foals, are affected. Is your horse at risk of gastric ulcers? Most horses with gastric ulcers may appear healthy without outward signs. Subtle indications include colic, decreased appetite, irritability, behavioral changes, poor performance, and discomfort. Equine gastric ulcer syndrome, EGUS, is a term that covers various stomach conditions in horses, including thickening, inflammation, erosion, and ulcers. Experts prefer to use the terms Equine Squamous Gastric Disease, ESGD, and Equine Glandular Gastric Disease, EGGD, because the causes and treatments can vary between the upper and lower parts of the stomach. ESGD affects the upper, non-glandular part of the horse's stomach. It occurs when the squamous mucosa is excessively exposed to acid. There are several risk factors that can contribute to the development of ESGD, like high carbohydrate diets. Overfeeding grain and other high-carb foods raises stomach acidity. Inadequate roughage is another risk factor. Increased exercise can also be a risk factor for ESGD. Commonly seen in horses that are used for high-performance activities like racing, endurance riding, and 3-day events. Equine Glandular Gastric Disease, EGGD, affects the lower, glandular part of the horse's stomach. The risk factors include increased use of anti-inflammatory medication that disrupts the stomach's natural defenses. Also, the lack of rest days between exercise sessions. And behavioral stress, such as breed disposition and an increased number of riders or handlers. EGGD is commonly seen in sport and riding horse populations. Omeprazole works by blocking an enzyme in the horse's stomach that produces acid. This helps the stomach lining to heal and reduces the chance of ulcers happening again. Introducing Equestra Equine Omeprazole, an easy-to-administer, enteric-coated granular solution with proven increased bioavailability. Equestra's increased bioavailability delivers more potent therapeutic effects and faster onset of action compared to other formulas, as demonstrated in peer-reviewed clinical trials. Equestra's unique enteric coating protects the omeprazole from being destroyed in the stomach and ensures it is safely delivered to the small intestine for optimal absorption. Say goodbye to the stress and struggle of catching an already tender and unhappy horse. Sprinkle Equestra granules onto 20 grams of dry feed before giving more. Each 2-gram sachet contains 500 milligrams of omeprazole. Equestra Equine Omeprazole, an easy-to-administer, enteric-coated granular solution with proven increased bioavailability. Equestra, the next generation omeprazole.